Continuing with Objective 6, now we're going to define, pronounce, and spell complementary terms related to the cardiovascular and immune systems and the blood. So starting out with the terms built from word parts. Arterioventricular, pertaining to the atrium and ventricle. Cardiac, pertaining to the heart. Cardiogenic, originating in the heart. Cardiologist, physician who studies and treats diseases of the heart. Cardiology, study of the heart. Hypothermia, condition of body temperature that is below normal. Intravenous, pertaining to within the vein. Hematologist, physician who studies and treats diseases of the blood. Hematology, study of the blood. Hematopoiesis, formation of blood cells. Hemolysis, dissolution of red blood cells. Hemostasis, stoppage of bleeding. Myelipoiesis, formation of bone marrow. Plasmapheresis, removal of plasma from withdrawn blood. Thrombolysis, dissolution of a clot. And then we have complementary terms not built from word parts. Bruit, abnormal vascular sound heard through auscultation caused by turbulent blood flow through arteries or veins. Cardiopulmonary resuscitation, emergency procedure consisting of external cardiac compressions, may be accompanied by artificial ventilation. So that's when they're doing the chest compressions and blowing it into the mouth for CPR. Defibrillation, application of an electric shock to the myocardium through the chest wall to restore normal cardiac rhythm. Diastole, phase in the cardiac cycle in which the ventricles relax and fill with blood between contractions. This is the lower number on your blood pressure reading, so remember D for down, D for diastole. Extracorporeal, occurring outside the body. During open heart surgery, extracorporeal circulation occurs when blood is diverted outside the body to a heart-lung machine. Extravasation, escape of blood or other fluid from a vessel into the tissue. Fibrillation, rapid quivering, uncoordinated contractions of the atria and ventricles. Hypercholesterolemia, excessive amounts of cholesterol in the blood associated with increased risk of cardiovascular disease. Hyperlipidemia, excessive amounts of any types of fats such as lipoproteins, triglycerides, and cholesterols in the blood. Hypertension, blood pressure that is above normal, which is greater than 140/90. This is in an adult under the age of 60, and recently they changed that to 130/80 should actually be the targeted range now, so it's actually should be lower than what is published in the book now. Hypertriglyceridemia, excessive amounts of triglycerides in the blood associated with an increased risk of cardiovascular disease. Hypotension, blood pressure that is below normal, again 90/60 Hg in an adult under the age of 60. Lipids, which are fats and fat-like substances that serve as a source of fuel in the body and are an important constituent of cell structure. Lumen, the cavity or channel within a tube or tubular organ. Murmur, abnormal cardiac sound heard through auscultation caused by turbulent blood flow through the heart. Occlude, to close tightly, to block. Phlebotomist, person who performs phlebotomy, which is the incision into a vein for the purpose of drawing blood or injecting IV fluids. Systole, phase in the cardiac cycle in which the ventricles contract and eject blood, so this is the top number in your blood pressure reading. Vasoconstrictor, agent or nerve that narrows the diameter of the blood vessels. Vasodilator is the opposite, and it is an agent or nerve that expands the diameter of the blood vessels. Venipuncture, procedure used to puncture a vein with a needle to remove blood, instill a medication, or start an intravenous infusion. Anticoagulant, agent that slows the blood clotting process. Blood dyscrasia, abnormal or pathologic condition of the blood. Hemorrhage, rapid loss of blood as in bleeding. And then we have a few more complementary terms just for the immune system. Allergen, environmental substance capable of producing a hypersensitivity reaction or allergy in the body. So common allergens are house dust, pollen, animal dander, various foods. Allergist, the physician who studies and treats allergic conditions. Allergy is the hypersensitivity to a substance resulting in an inflammatory immune response. Anaphylaxis, exaggerated reaction to a previously encountered antigen such as bee venom, peanuts, or latex. While symptoms may initially be mild, such as hives or sneezing, anaphylaxis can quickly become severe. When it leads to a drop in blood pressure and blockage in the airway, it could be called anaphylactic shock. Antibody, substance produced by lymphocytes that inactivates or destroys antigens. Antigen, substance that triggers an immune response when introduced into the body. Autoimmune disease, disease caused by the body's inability to distinguish its own cells from foreign bodies, thus producing antibodies that attack its own cells, or own tissue, I apologize. Immune, being resistant to specific invading pathogens. Immunodeficiency, deficient immune response caused by immune system dysfunction brought on by disease such as HIV infection or immunosuppressive drugs such as prednisone or cancer chemotherapy. Immunologist, physician who studies and treats immune system disorders. Immunology, branch of medicine dealing with immune system disorders. Phagocytosis, process in which some of the white blood cells destroy the invading microorganisms and old cells. And vaccine, suspension of weakened or killed microorganisms administered by injection, mouth, or nasal spray, which induces immunity to prevent an infectious disease. So we have a few pictures to look at. So here they're asking you for the word that means pertaining to within a vein. So they're doing an IV catheter. So that would be intravenous. A patient diagnosed with leukemia would seek treatment from which type of physician? So again, they all end in logist, which is a physician who studies or treats. And so the one that would deal with leukemia would be A for hematologist. Remember, cardio is heart. Phlebo would be vein. Here are just different types of heart rhythm. So a normal rhythm, AFib, and then ventricular fibrillation. Here's just where the defibrillator paddles would be placed. You know, that again, that's when they tell you to clear, and then they shock the patient's heart again. And that will end this recording.